Updated the 13th of November 2017, 1610 AEDT Fortyyearold Rathwan Alasbahi lies in the dialysis unit at ALThawrah Hospital in the Yemeni capital of Sanaa. Acute medical supply shortages in Yemen mean he is receiving just a fraction of the treatment he needs. Each day is struggle to survive. I was diagnosed with renal failure and I need a kidney transplant, he explained. Hospitals in Yemen are no longer capable to do kidney transplantations. After 2.5 years of war, Yemen's health system has collapsed, and now a tightened blockade imposed by the State-led coalition for the past week means patients like Rathwan have no way of leaving the country to receive treatment aboard. He realizes he does not have long to live. We are asking international organizations to please try and lift this blockade of Yemen, Rathwan told the ABC. The Yemeni Ministry of Health estimated that even before these new measures, 10,000 patients in the rebel-held north died in the past year waiting for medical care not available in Yemen. Sadly, now with the closure of all the airports and other ports, it has shut off all safety doors to save sick people, and that has led to a vast increase in our death toll, said Dr. Ali Al-Amri, the president of the hospital authority in Sanaa. Severe cases which have medical reports stating they need to travel abroad immediately to receive medical care occur on a weekly basis at ALThawrah Hospital. Yesterday, at Al Sabin Hospital in the capital, the ABC's producer in Sanaa witnessed more than a dozen emaciated babies and toddlers receiving treatment in the malnutrition ward. Their tiny skeletal bodies are evidence of the dire food crisis that is overwhelming this country. Before aid shipments and flights were cut off last Monday, 7 million people in Yemen were already on the brink of famine, with more than 20 million reliant on food aid. And the UN is not mincing its words when highlighting just how many lives hang in the balance here. The UN chief warned that if Saudi Arabia does not allow increased aid access to Yemen, it could lead to the largest famine the world has seen for many decades, with millions of victims. I hope there's increasing awareness around the world about the magnitude of the crisis in Yemen, said Australian Suze van Meegen, the Yemen advocacy advisor for the Norwegian Refugee Council. Ms. van Meegen is stuck in Amman, Jordan, waiting for the State-led coalition to allow UN humanitarian flights back into Yemen so she can return to work. The impact of the current blockade is massive. We're looking at a population that is larger than Australia's. Their risk of a famine or a crisis that is unprecedented is very, very high, she said. And the fact there are no journalists allowed in the country limits the visibility of the crisis. The aid worker said she was just one of dozens of NGO and UN aid workers currently blocked from accessing the country at this crucial time. It's likely that stuck outside Yemen there are as many as 50 to 100 experts in things like water and sanitation, health, food and logistics that are all needed to maintain the humanitarian response, said Ms. van Meegen. As well as that, of course, there is a huge number of people stuck inside of Yemen. Swingo workers and UN officials who are essentially being held hostage. Yemeni human rights campaign Osama al-Faqi, who works with the Mawatana organization, described the situation as catastrophic. He said thousands of Yemenis around the world were trapped outside, unable to make it home. This closure also made it very hard for people who are stuck in other airports and in other countries to come back to Yemen, he said. Is very difficult for them, especially if their visas have expired or if they don't have enough money to stay in these countries.